Hey everyone, welcome to the Fighting Dementia Podcast. We're a podcast for those living with dementia or those supporting someone living with dementia who are in the early to middle stages. I'm Leon, one of the presenters.
Hi, I'm Fran and I have Alzheimer's and mixed dementia.
And I'm Tom. I was diagnosed with mixed dementia 8 years ago and I'm living really well with it.
Hiya, it's me, Fran, and
Tom again
today, and we're fortunate enough to have two ladies from the Liverpool Council who are going to discuss with us what they're doing and trying to implement for patients and people around Liverpool for dementia, basically making strategies so everybody is seen in a manner that they need to be seen in. So I'd like to introduce you to Emma and Ellie, and they'll explain to you what their role is.
So, hi, I'm Emma Ciclatera. I'm a senior public health practitioner in the public health team at Liverpool Council. My role is I'm the healthy ageing lead for the public health team. So a big part of my role is looking at what we can do around dementia to prevent people from developing the condition, reduce those risk factors, and also raise awareness of dementia across the city.
Thank you. And Ellie will now tell us what her role is.
Thanks very much, Fran. So my name's Ellie Garnett and I'm the Director for Adult Strategic Commissioning in the Council. So I'm responsible for making sure there's the right sort of care and support for people in the city. So that can be things like domiciliary care or care homes or supported living. It can be things like technology-enabled care. So whatever is the right thing to allow people to live as independently and as well as they can, in where they want to live, doing the things that they want to do. So we work really closely with Emma and we work alongside. So whilst Emma is focused on prevention and the things that we can do to live better, it's our part of the function of the council really is to pick up when people do need to draw on care and support and make sure that it's done in an informed and inclusive way so that it's dementia-friendly, it understands, it's good quality, it thinks about carers, families, anyone that's affected by dementia, and that we're doing the things that matter most, and it's getting the outcomes that matter most to people who are living with dementia and their families.
That's brilliant. You say you work close together. Your role's different to Emily's, isn't it? So how does that work?
Mm-hmm. So I suppose we've just this week launched the Dementia Strategic Action Plan. And this plan was developed with both public health and adult social care, as well as the NHS Liverpool Place colleagues. So this is an example of kind of the partnership working that we've done. We've identified, we've engaged with local residents, people living with dementia and their carers. We've engaged with partners across the city, and we've worked together to identify what our priorities are and how we're going to, or what we're going to work on over the next 3 years together.
Mm-hmm. What's in place now that's going to be different when you've both looked at the problems and things that aren't working properly, or things that are working well and you'll keep them, but things that aren't, that you'll change in your strategies?
Oh, that's a good question.
We were talking before, weren't we, about the fact that obviously in the current climate, budget's quite a challenge and demand for services is always greater than the capacity they can offer. So if we had to describe it in a sentence, I think it's about doing more with what we've got. So more kind of intelligently linked up services. So we started to talk before we came on about, making sure it's information is connected when you need it most. So we've talked in the past about the point of when you're diagnosed, not feeling like you're just left, but understanding actually what's there, the support groups, what you can expect to happen next, what happens when needs start to change, and you kind of move through a pathway of different things that you might need as kind of life progresses with it. So if you had to sum it up in a sentence, more connected, so it feels seamless and it feels like a pathway, and it doesn't feel like you have to, as the person with it, you don't have to go off and find something that it's obvious and it's there when you need it.
It seems to me Liverpool's got it all sorted, because where we live there's nothing like that. There isn't.
I think I wrote a report a few years ago. It was called the Joint Strategic Needs Assessment, which is a bit of a mouthful, but it's basically a report to show what services are there in the communities and available for people, and what the need is.
Yeah.
So how many people are living with dementia? What are their health needs? And is there the support available to meet those needs? And the report recommended that, it shows that there are lots of support services in Liverpool, but they are not connected. People don't know where to go at what time in their journey.
That's the problem.
So it's all done in silos. Yeah, we need to connect it all, as Ellie said, and make sure those pathways are there so that people get the support at the right time.
So how many is in your teams at work? Or are you doing this alone? Or are you...
I'm the healthy ageing lead, so I do the dementia work on my own for public health. But as I said, I'm not on my own. I work really closely with adult social care and with the NHS. So, and also the LDAA are absolutely fantastic in all of this. Without their support, we wouldn't be able to do half of what we're achieving in Liverpool. So I work really closely with Jack and the LDAA members, Merseycare. We do work really closely together to make sure that things improve and things change.
Yeah, I'd agree. I don't think you can rely on sort of, it's not a single person's role. It's a system, isn't it, of health and care. And we were part of the action plan that Emma is the lead for, talks about how we make Liverpool dementia-friendly city. So how we think about, is our transport accessible for people with dementia? Do people that are in public-facing roles understand what they need to do if they're faced with someone with dementia, and how do we open things up and be inclusive rather than it be about kind of the person with dementia and what they might need to do. It should be about what the rest of the world needs to kind of do and flex and be understanding about. So I think it's absolutely a system, because
it's true, isn't it? Because if you have cancer or you have any other type of disease, that's just, everyone talks about it. Everybody, there's a big system that takes you from the top to the bottom. But we've found with people who are diagnosed with dementia or any form of dementia, that it's not taken as seriously, and especially, and I don't know whether you're dealing with young-onset dementia patients now, or people, a little bit more than what you did initially when you started this. And I think that's something that's got to be in that strategy about young-onset dementia.
Definitely.
Rather than what we call people with older, they get early onset dementia. And we were discussing this, weren't we, the other day, about if you've got early onset dementia, that doesn't distinguish that you're young or old.
Yeah.
No.
More likely, in an older person, you will say, oh, they've got early onset dementia. But because we're getting so many people coming up now who are in brackets of 40, 45, 50, they're young onset dementia patients. So their needs will be different than the needs of the people who are much older. And we know now we're getting a population that's living a lot older. So we're going to have God, let's go through then. We're going to have, so we're going to have a time where dementia is, well, it's more or less at the top of the list for death now anyway, isn't it? So we're going to have a time where we will need all these strategies. And I don't think people realise, because you say public health, people think that's just something totally different. You think of the public health as being like biochemistry, or things like that and stuff. But that's what we want to get across to people now, that it's not, the public health are working hard to try and get these strategies and things in place.
Absolutely.
That is difficult for everybody. So how do you budgets? Are you set a budget, or do you continually claim when something else comes up that you need this, or is the government put something in place now that it'll be accessible?
We don't really have a budget as such. We have recently awarded the Liverpool Dementia Action Alliance some funding to be able to reduce inequalities in dementia. So they are going to be developing a dementia champions role, or several of those roles across Liverpool, looking at minoritised communities. But that also includes young-onset as well. So kind of focusing on those communities where either dementia is
good,
there's a high prevalence of dementia, or looking at communities where they're not accessing health and social care, and they're, for whatever reason, whether that be sort of cultural or we're targeting those communities that need the help the most, to try and reduce inequalities. So there is a bit of a budget for that, but again, not a
huge one. Can you think of a strategy for living well with dementia?
The things we're doing to look at prevention of the risk factors of dementia. So in the action plan, we are looking at health checks. So everybody between the age of 40 and 75 are eligible for a health check. At the moment, dementia is kind of potentially mentioned.
Yeah.
We don't know if it is being mentioned. So what we're doing is we're working with Merseycare to look at a screening tool that can be used within those health checks to make sure that we can identify people earlier.
Yeah.
In terms of reducing the risk factors are very closely linked to those for cardiovascular disease, so your heart health.
Yeah.
So we're going to be working really closely with colleagues who are trying to prevent cardiovascular disease in our communities, and make sure that the messages around what's good for your heart is good for your head.
Yeah.
Get those messages out.
That's what Liam keeps saying to me. What's good for your heart is good for your head. I don't take any notice.
That's when he's finishing a pack of biscuits.
Yeah.
But I don't think a lot of people know that the risk factors for dementia, that there are the risk factors. There's 14 risk factors. And if we make people aware that there is something they can do to reduce their chances of developing dementia, then that would be great. But I think, there's still a stigma around dementia. So it's kind of breaking down those stigmas, telling them that they can reduce their chances of developing it. And we have actually just got a leaflet coming out in the next few weeks, which explains all of this and how you can prevent.
Does it give you the 14 factors?
It gives you the 14 factors.
Do you remember them off the top of your head?
Not a chance.
Can you, Fran?
Good question.
No, I would say diet one.
I think it's thinking about when you were talking about budgets, that's kind of an interesting element about knowing Liverpool really well as well, isn't it? And the sort of layers of complexity that we see in Liverpool. And there is something about kind of, the council and, the kind of general system's duty to raise standards anyway, because that's a protective in a way, isn't it?
Yeah,
like
it is.
Economic health, how good your housing is, like attitudes to drug and alcohol use, all of those things throughout the life are part of that journey, aren't they? And actually part of kind of that wider responsibility that Emma and I would share to kind of contributing to improving things to make sure people aren't facing those kind of multiple layers of deprivation and things which might affect health in different ways when they get older.
I think the inequalities that you're talking about, I'm thinking they're people with ethnic minorities.
Yeah.
Because we've come across quite a few people
we have.
that have found it very difficult, who are looking out for people who've got dementia, to bring them into the dementia community because of their cultural issues. So that's something that we do need to work on, isn't it? It's something that's and especially in Liverpool, because we have such a multicultural areas, don't we? And that's sad to think that them people are not getting, like you said, about housing, social problems, people who are, and the other thing is denial within families and people, isn't it?
Yeah.
They don't know or they don't want to know that that's what people have. So I think if you explaining things and doing what you're doing, it's going to bring it forward so much quicker, isn't it? And then
there's also a big piece of work around training Training and education. So we're looking at training. We're starting off with adult social care colleagues and developing a training kind of framework for all staff in adult social care to be trained in dementia. And then we'll be rolling that out across hopefully the council and other organisations. It's a huge piece of work. So starting small and expanding. But again, we know that if the more people we can train to and educate on what dementia is, how you can support people, what services are out there locally, how to communicate with people with dementia and their families and carers. It's also important to just make people's lives better.
Do you have anything that informs people young onset dementia that the life hasn't ended, that just can carry on doing whatever they want?
Yeah, I think a really important part of the strategy work that you've done, Emma, is about awareness in general, because you're right. And I think, when you very kindly said it, it seems like you've got a lot worked out. It feels very much like we're still at the beginning, because there's something about that understanding. So you're quite right about early onset hasn't always been understood and challenged. I know we've met before at some of the early onset support groups that exist in the city where we've been, and the director for adult social care and the Liverpool City Council Deputy Chief Exec Anne-Marie has come with us, and we both reflected that actually, you might know the statistics, but you don't understand the impact and how different the physical bits, the impact on people's lives, the different sort of support people, what's going to be important to those individuals. So I think there's a lot more work for us to do on the two things we've just talked about really understanding early onset and what we need to do to support, and where alongside that general awareness and acceptance and inclusion about it, and equally with ethnic minority point, I think there's only so much that we understand about the nuances and the different responses that people with different backgrounds might have themselves and their families, in their communities, all of those things. And there's small pocket, again, as we keep saying, the small pockets are great things, isn't there? Like the Active Mind Day Centre that recently was established, which is great in the L8 community. But there's again, I think there's more work for us to do to understand that more deeply and hear more soundly what that means in reality, and what we need to make sure we're building in to things as we go forward for both those groups that might not have been understood. Yeah,
we've got neighbourhood managers so we've got 13 neighbourhood managers who work across 13 neighbourhoods in Liverpool, and that's a really good way for us to work in the future and really get to know those communities on a smaller footprint, because they work day in, day out with those community members and the businesses and organisations who work in those areas. So that for me is a really great opportunity that we've got now, and that's only been developed over the last couple of years. So we can definitely make the most of the neighbourhood managers and the work that they're doing and link it all in with dementia.
How do you advertise yourself then? Because that was our problem, wasn't it? We didn't know where to go, what to do.
No, we didn't. We still don't, do we?
But how is the whole spectrum advertised?
All the different services.
I don't want you to mention them up, but there is lots of different ones,
isn't there? Services.
And there's what we've got to remember in here as well is the people who are caring for us.
Yeah.
And that's another thing that has gone behind greatly for a long time now, where it's genuinely needed for people to be aware that these people
need help as well, don't
need help as well. Absolutely. Yeah.
In terms of information and signposting and where to find out about the services, in the action plan, it does one of the key actions is to look at information, advice and guidance. So look at where people can access information, how they're accessing it, hopefully creating a kind of place where it's all in one, or if all the information you will need is in one place, so you can access it
just
easily.
Take the little bits out.
That's what you need, isn't it? It's all there for you then.
Exactly.
Instead of trying to run around trying to find different people to tell you the same sort of thing.
Exactly. So that's what we hope to achieve.
Brilliant.
Is it worth mentioning that alongside the Dementia Strategic Action Plan, we've recently launched our carers strategy for the next 5 years, which
great.
so we see them as kind of like partner strategies to each other almost, because you're absolutely right. The impact on carers is huge, and that caring responsibility, we know from the kind of analysis that we've done, is only going to keep increasing. And actually, there's some we had a presentation this week on the care annual. So we have legally every year we have to go out and do a big survey of all people we're aware of who are doing a caring role in the city. So we just took a look at those results in loads of detail, and it shows actually people are caring for much longer than they used to. So we have a big set of people in the city that care for up to 20 years, for example, that are caring, the hours that they are delivering care for are growing and growing. So we do recognise how important it is to make sure we're supporting our carers the right way, because actually, that's the right thing to do, isn't it? Most people doing that are doing that because they, from their love and care.
Well,
and
if the carers aren't healthy, then
exactly,
they can't look after you, can they?
So, we've got a job to do in propping those carers up, or providing the right sort of support, or when they need a break, or what practical things they need to be able to keep doing that caring role, because that's the right thing for everyone. And actually, so that's really, really important. So the kind of carers stuff, and there's things like how we make sure that again, we create the right fabric for people to do that. So how do we make sure that employers understand what it means to be a carer, and that it's easy for people to get time off when they might have to support you to go to medical appointments or things like that. That's a really big focus, for example, of the carers strategy. So it's really sort of delicate fabric, isn't it? A stuff that we need to try and knit, and that's part of our work as
Whenever I have appointments, my wife has to fight to get time off to come with me.
That's so wrong.
Just don't listen.
Isn't it? Yeah, it's so wrong.
Or if she does get time off, they take it off her in some other way. I know.
It does happen though in this day and age, still, doesn't it?
And she works for NHS. Wow. So it'd be a caring community, but I don't think they are.
Wow. There's real variation, isn't there? And again, that's kind of, when we often laugh, don't we, when people say, "What's your job?" and you're trying to explain. It's really complicated to explain, isn't it? But I think that's part of our role, is kind of getting those conditions and spreading the right kind of environment, to allow people to be okay in the middle of it all. So that example is really, really interesting. So there's some NHS partners which are really great around carers. Like I know Merseycare do a lot as an employer, for example. The DWP do a really amazing scheme about a carer's passport. So the person that's a carer doesn't feel like they sort of have to declare it. They've just got that on their HR record. So if they are asking for time off, or they need to take a bit of extra leave, or start later, or what there's that sort of flag around. That's why they need support. So it's not a difficult comment. So so the carer strategy is looking to try and drive at things like that, as well as just things. So there's other options. So you can just dip in, and connect to a PA that might be able to do that at the times when they really can't be there. Where there's something as well, isn't there? We were touching on earlier about equipment and sort of AI and technology that might be able to support, to give prompts, or help monitor things like conditions in someone's home, so they know that it's not too cold or too damp, and that might increase someone's risk of falls, for example. All those sorts. So there's all that kind of part of
Tom has Alexa and keeps shouting at her.
Yeah. Tell me to take my tablets, have a drink, something to eat. I just shout at it.
I do that too.
Definitely.
I don't have to tell jokes, mind you. It's good at that.
It is, definitely. Helps me parent Alexa. So,
what do you see the future for dementia then, for people who have dementia? And because there's so many different types, isn't there? People don't seem to realise that as well. There's so many different types of dementia, and then having a different type, physically wise, you're different, and mentally wise, you're different, aren't you? It's not the same as someone who you might find just sitting. You might find someone who's aggressive. There's so many different things, or the physical part of their lives has changed. And I've forgotten why I've started talking about that.
Well, I haven't got a clue either.
No.
What do you see in the future?
Yeah.
For me, it would be great if Liverpool truly was a dementia-friendly city. So
Yeah.
the shops, the cinemas, the restaurants, everywhere, the transport would all be aware, be friendly, be open, and welcome people with dementia and their carers, and that stigma to not exist, so that everybody would just accept and include people with dementia and their carers in everyday life. That for me would be amazing.
I think it is education, isn't it, Tom? Because people will say to us,
you don't know like you got dementia.
Yeah.
It's the first thing they say. So you're supposed to have that fella, what was that programme where you used to have a H on his head?
Harry Hatman. No, I know you mean, Go on, carry on.
We should have a D.
Red Dwarf.
Red Dwarf.
Yeah.
Because people just assume that you're okay.
Yeah.
And you're not okay. And that's not always their fault either. That's because they have no idea of how to deal with somebody who is like that. But the sounds of what you're saying and the things that are going to go in place, it's quite exciting, isn't it, really?
Well, it's, Well, I just live my life how I feel like it.
But it's nice to know
there's and there's stuff going on that can help people.
Yes.
Yeah.
Do the studies you do they get spread all over the place, like over to Ellesmere Port or Chester? Or...
We do share. So there's a Cheshire and Merseyside dementia group, which I sit on, and we do share learning, and we share good work that's happening and what we're doing, and we do work closely together. So yes, we do. The reports will get shared, but we don't work too closely, and everywhere's set up so differently in terms of their priorities and what people need and what people want in each area. So it's sort of
we've got the shared pledges as well, haven't we, in the Liverpool City region? So it's something that Mayor Steve Rotherham is a big advocate for. So and I can't remember how many pledges there are. 10. There's 10 pledges, so that we're all signed up to deliver against, which is about kind of those far-reaching kind of bits. But you're right, that's always the answer, I think, in our sort of roles is sharing and best
the
practice,
more people know, the better,
each other. To do, what's worked well for us is going to work well in other areas, and people that do our jobs in other councils and other parts of the NHS. So it's really
We've heard nothing of this over our side. In Ellesmere Port, there's just no sort of information going anywhere. So I don't know what they're doing. I think I'll have to move over here.
So you're just discussing a roundabout.
Magic roundabout.
Yeah. About over the water there. Ellesmere Port.
Yeah, the place to talk about.
Places where they're not getting as much input as Liverpool are getting. So is this going to be, say like when I was in there, we had a Muse chart, took your temperature and everything. And at the end of the day now, when I was there, nobody had the same chart that year. Other hospitals, if you transfer, it would be different. Whereas now, every chart is the same. No matter what hospital you go into, it's the same. So everybody knows where they're working from.
Yep.
So would that be happening nationally, locally, when it comes to the strategy for dementia patients, young onset and aged people?
So for the strategy, there is a Cheshire and Merseyside strategy that has just been finalised and launched, and our Liverpool one has aligned. We've worked closely with the people who produced the regional strategy to make sure that they're not identical, but they have the same themes going through. And there are some key actions that are exactly the same, so that we are working to meet the same levels and the same standards. In terms of nationally, the NHS have just released the Dementia 100 toolkit, which is a kind of list of criteria that they would like every place to, so every local authority or every ICB place to work towards.
Yeah.
And the idea is that you measure where you're at against those criteria, and then you know where the gaps are and where you need to work towards. So there is that, which is fantastic, because that will hopefully standardise the approaches across.
That's what it needs, standardising, doesn't it?
Yeah, the NHS are quite strong, aren't they? That they would say unwarranted variation. So where you can see that that's probably familiar to you, but where you can see something that's not right. But I think in social care, it's probably more difficult to compare and contrast. Actually, so we're asked to report certain performance measures kind of nationally, and it shows if you're not great at it. But there's a lot of work in the kind of area of social care reform at the moment, the Casey Commission, for example. And part of that is to drive at how do you get to that more NHS culture of unacceptable variation from one area to another, what really matters as a kind of outcome framework for social care delivery, and where can we have that kind of sort of a raising of standards, so you've got a kind of minimum expectation, but ultimately I think we're often told our bosses are everyone that votes, really aren't they? So in terms of us doing a good job, but I mean day to day for us, we always try and run things and make things work.
And it's difficult because there's so many spanners tucked in on the way, isn't it?
Exactly. So you have to keep it simple, don't you? And we call it the mum test. So we just challenge ourselves. Is it good enough for my mum? And if it's not, then we
nice,
try and do something about it. Yeah.
That's really been informative, and it seems like you're really getting stuck in there to try and improve things as much. So thank you for that. We're going to have a little break now, and we do like a little reminiscence corner, and we have a little chat about that. It'll probably be something to do with what we've discussed today. If you're happy to stay and do that with us.
Or Lolly Fish.
Anyway. Thank you for having us.
You're welcome.
Thank you very much. It's been great.
Thank you.
It's been a pleasure.
We really hope you're enjoying this podcast. We want this to be one of the best free resources for any family affected by dementia. With your help, we can build the biggest community in the world for supporting, guiding and comforting everyone who faces cognitive issues and the people around them. So please hit that subscribe button or share it with someone who needs it. What advice, George, would you give to someone newly diagnosed or to their family?
Okay, to the person, keep on doing just what you were doing before. Don't stop anything. But equally, find other things that you enjoy doing. Do anything that gives you pleasure. And to hell with risks. I mean, you wouldn't go and jump off a cliff, but at the same time, there are risks all around us all the time. So just do what you want to do. And if you need a bit of support to help you, you'll probably find it. But for goodness sake, don't sit at home and think the world is over, because it isn't. You're the same person as you were the day before your diagnosis. And often, if you keep living well, as well as you can, and we can't all the time, but if you keep living as well as you can and as active as possible, you will last a lot longer.
He's correct though, isn't he? That's what you should be doing.
Right,
Don't just go, I've got dementia, I'll just sit here and watch the world go round out the window.
It makes me laugh.
Does he?
Yeah, like you do.
Oh, I do my best.
But it's like, it's true, isn't it, Ron? It changes your life. Yeah, Tom.
It does change your life, but it hasn't got
you know what I'm like for names.
But it hasn't got to change for the worst. It can change for the best or better. At least you just carry on what you're doing. I know everyone's different and it affects everyone differently, but you just got to carry on. No point giving up.
You meet different people along the way. Like, we'd never have done a podcast in our lives.
No,
would we?
Too nervous.
You know, I mean, that you two say, and people in Sedgemoor, wherever we go, or what we're doing, and and that gives us more encouragement to go and do what we want to do, doesn't it? But I've just met like Leon and Marion and, and these are my friends now, and the people who are encouraging us and wanting us to do well, not to be like sort of at home doing nothing.
Vegetating.
And that's what we do, cause havoc.
We do. Everywhere we go. We try our best anyway.
Yeah. And you can get away with it with having dementia and Alzheimer's. Because you can go, sorry.
It's good for birthdays and anniversaries as well, because you can forget and you don't get told off.
Yeah. You can use it to your own
advantage.
That's the word I'm looking for.
Same with robbing a bank. You could do that and say, well, got dementia, I know what I'm doing. Shoplifting, there's another one.
But he's right, isn't he, in saying about looking after yourself and doing things differently, like, eating properly, doing, get up and get out, go into nature, go and do things that will keep you occupied. Even if it only gives you a few more years, which it will, you're getting a few more years of something that's been nice and exciting and not what you thought. If someone had told Tom and I 6-7 years ago that we would be where we are, we wouldn't have been as stressed. We wouldn't have been as, and I know they can't say that because the disease is so unpredictable. But if we'd known, and we're fortunate enough now to tell other people about it because we found it, didn't we?
We did.
And
but Marion thought I wouldn't be here now. I'm 9 years in.
But you did as well, didn't you?
Yeah, because nobody tells you you can live with it. It's all doom and gloom when you get your diagnosis, but it's not.
It's not the nicest thing to be diagnosed with. And it is difficult, but it changes your life. Like that man said, you are the same person from yesterday, but your wiring's a bit different.
Yeah.
And you have to learn to, like a 2-year-old, you have to learn to work with that wiring and work from there. And that's what we do, isn't it?
We do, yeah. Do our best.
Wow.
That's what you got to do.
That's so inspiring.
It is. It's fantastic.
Yeah.
And these are the kind of messages.
And Leon pays the bill. He pays for all our drinks and everything.
Excellent.
And our food.
Yeah, but it's only water he pays for.
So it comes in handy.
Yeah, he does.
Watching that video, though, it makes me think about what we're trying to foster in terms of social work approach. So you call it like asset-based and building on what people can do and want to do, and what he's describing, that kind of risk-enabled way. So, accepting there might be a bit of risk, but the benefit to that individual is far greater than that little bit of risk that might sit there. So, they were my reflections listening to speak. Actually, that's completely in line with the way that, a good modern social work team should be delivering social care. So it's, really interesting.
There's a lot of people who have skydived and done all kinds.
Yeah.
And stuff that they would never, ever have done.
Well, Manny won't even go up a ladder.
I don't blame him. I don't blame him.
I nearly chopped the end of my finger off the other day.
Yeah.
But there you go.
With the chainsaw.
Yeah. Well. I've got 9 more. What's that worth worrying about?
You won't if you use that again.
No, I won't be using it again because man will lock it up. I'm banned, I think.
I suppose my reflections from the video was that I don't know how many people know that if you are more active or stay as active as you are and you eat healthily and you don't smoke and don't drink so much and all the other risk factors, if people are aware of that when they are diagnosed or beforehand, ideally, then how much of a difference would that make? And we do need to look at the information that's available on diagnosis and really review that to make sure that it's the information that people need and people want at that time and not just what the health professionals or we sort of behind our desks think that you might need. It needs to be relevant and it needs to be useful to you. So
I think they need to talk to people with dementia.
Yeah.
Yes.
Then they can tell you what they need and what they think they need, and hopefully that'll help somewhere along the line.
Yeah.
Cool. Thank you for volunteering.
Fine. I'll be there, not a problem. I've got plenty of time on my hands now.
I think younger people need to be aware. Schools need to be making sure, talking not necessarily about dementia, but talking about illnesses in later ages that you can delay if you eat properly, drink properly. By no means don't go on your holidays and not have a nice time, but, make sure that they're aware of what, Because some kids are looking after people with dementia.
Yeah.
I'm just going to say that they'll see it
and that's very sad.
In their grandparents or parents or,
Definitely. Yeah. Or other neurological diseases. But if they're aware of the fact that, genetic ones you cannot avoid, but you can make them easier.
Mm-hmm.
It's like us, isn't it? It's made us easier. And we've both got different types.
Yeah.
I've got Alzheimer's and vascular. And
I've got mixed dementia. I've got frontal temporal lobe. And is it Alzheimer's there? Yeah. Yep, there you go. Couldn't remember then.
So everyone's different, but you can work out a plan to keep yourself healthy and look after yourself.
Yeah. So again,
especially when you're younger.
Maybe these plans need factoring in for people when they are diagnosed. Sort of what would you like to do over, now? I don't know if those discussions happen with anybody when you're diagnosed.
No, it didn't.
That was me.
So maybe that is something that we need to look at.
The dietitian last week was amazed, wasn't she, that had never happened.
No.
And she's just got on board. Kirsty, her name is, she's lovely, isn't she, from Dundee? And she's got on board now. She's sent us all stuff. Yeah. And she was surprised that, people with young-onset dementia weren't getting that.
Yeah.
It's fascinating. So it's been good, hasn't it, Leon?
It has. I think I spend some time talking to people who've just been diagnosed, just to say to them that you can do whatever you want. There's nothing stopping you doing anything. And I know it affects everyone different because they keep getting told that. But just to speak to someone and say, your life's not over now.
Yeah, but that's so comforting, isn't it? When you meet someone that's in the same
and
boat
especially for who's looking after them.
Yeah, definitely. Yeah.
I think the carer worries more than the person with it, because I don't worry about having it, but Marion worries about me a lot.
Yeah, that's true. I don't worry about having it.
Yeah, no.
Yeah, just get on with it.
Worrying about? It's just life, isn't it?
Yeah.
I forget to worry about it anyway.
Right.
Welcome everyone to the first edition of the little segment we're going to do called Oily Fish.
Oily Fish.
Where, based on Kirsty, our lovely dietitian from Dundee from last week, we're going to talk about what we've eaten this week and how that's been in terms of diet. How's it been?
Good.
What was the first word you used when I asked? What was the first word you said when I said, "How was your diet in the last week?"
Shite.
Yeah.
A perfectly good word, I
suppose. But I did try to compensate. I've been out for meals this week and things. So I had a big roast dinner and sticky toffee pudding on Sunday. Yeah. And then I had on Monday Chinese meal with sticky toffee pudding for...
You had a sticky toffee pudding in the Chinese?
Yeah.
Wow.
Do you do them?
No way.
And
there you go.
That's good. But in between that, I've not picked or done anything else that I would normally do because... Did
it make you think from last week a bit more about...
Yeah, it did, diet? But because I had those things arranged... Mm-hmm. I wasn't going to give that up.
Well, Sunday roast and a Chinese now and again as well, I suppose.
Yeah, so I've just sort of cut back, not as much as I would normally eat lately, and I've drank some more water.
No.
And have you added anything in from what Kirsty was discussing in terms of the Mediterranean diet or the Mind diet?
Well, when I'm not eating what I've had them 2 meals that I've had, I'm eating... juiced drinks like lettuce because my husband does that because he drinks them and he drinks ginger and beetroot and things, so I've added them in
stuff,
now. So I drink them and they're quite nice, you can feel the ginger.
You sound surprised, Fran. That's quite nice.
You taste it, because the ginger's so fiery, you're getting a good hit from that.
You can get a kick from the ginger. The lettuce looks like something you'd put in the bin.
Well, you would, wouldn't you?
I don't taste it, so just swallow it. And it's, but I know it's doing me good, so I've started doing that. So I'm just making little... Yeah,
well, that's all you...
Little steps.
It takes a long time
because I've got to get myself back on par and, keep doing that. But I'm not going to do without if I go out to somewhere.
Of course.
But I'm not going to go mad.
Mm-hmm. And how about you, Tom? How's it been since last week?
I've had 3 bottles of water a day. Most of this week. I've had hardly any sugar, have I?
No. Oh, no. Well done.
Mm-hmm. I've been laying off the salt, but I did have some biscuits, I must admit. But apart from that, I've been fine.
Overnight oats.
Overnight oats as well.
I've had
yeah.
them. Sorry,
Yeah.
Did
I've
you?
had them. I got a little jar in B&M,
How were they?
and it goes
Did you like them?
oats, yogurt,
Yeah, and then some
Fruit.
fruit. Yeah.
and you can put some nuts on it. It said on the top.
Well, there's
And I
plenty
done
of
one
us.
for me and Frank. I can't taste them, but it was nice. The texture was nice
Yeah.
of it when
What
you
did
mixed
think
it all
of
up.
the overnight oats?
It's nice. I enjoyed it because it had honey on it.
Mm.
Oh,
It's very
yeah.
nice.
And a bit of
Yeah.
fruit.
Blueberries, wasn't it?
Yeah.
Mm.
Yeah, blueberries.
I had raspberries, strawberries.
There you go.
So it was all right.
Mm.
Anything else in terms of what we learnt from the Mediterranean diet?
We had only
Or the
fish. Didn't
mind
we?
up?
We had mackerel, didn't we?
Yeah.
Yeah, we had mackerel.
Lovely.
Yeah.
Did you enjoy that? Because that's quite a strong
It's
flavour.
lovely. So it's lovely.
We've
Mackerel,
done
yeah.
the peppered mackerel you can get.
Oh yeah.
So that's got a bit more flavour to it.
Nice. What about you? Are you into the mackerel or
Nope.
no? So when it comes to oily fish, where you at?
Well,
Sardines.
Twice a week,
The
I think
local
Kirsty
chippy.
recommended.
yeah, I
To have
don't
fish.
like salmon.
Don't like smoked salmon.
No.
Oh,
So I was just talking to Marion, and I'm going to get the mackerel in the tin with tomatoes, because I remember I used to eat that when I was in work as a nurse, because it was only in a small tin, so it was quick to eat.
Nice.
And that, so I'm going to get some of them this week, and I'm going to make sure I have 2 of them.
So overnight's already in. You're going to add mackerel. So
Yeah.
we'll talk about that next time we're
Yeah.
on.
Yeah.
Anything for you that you're keen to add, or Marion? Anything that you're thinking that can move towards the Mediterranean diet? Like 3, I've just got it in front of me. Vegetables twice a day, 3 servings of fruit a day. Nuts.
I have an apple every
Beans.
day.
Hmm?
I have an apple every day. Does
There
that
you go.
count as 3 a day or whatever?
That's 1.
Yeah. And I eat bananas if they're there.
Bananas if they're there.
You
Okay.
need to get more fruit.
More fruit. Yeah.
And
How
more
about you, Fran?
vegetables.
Well, I can't eat a great deal of fruit because we're having type 2 diabetes.
Okay.
So I'm not really eat bananas because they're not good. But I have the juice drinks that Frank
Oh,
makes,
yeah,
and
yeah.
they've got, one of them's got beetroot, orange, and carrots in.
Nice.
So I'll do that. And the other thing I'll eat is raspberries
Mm.
and strawberries. They're the only things that I like from that point of view. But
Happy
I'll eat
days.
them.
And Marion, you've made us some cake,
Yes.
which is counterintuitive to what we're doing, but it's fine. You
no,
said
because there's no sugar in there.
no added sugar. Wow.
No.
What have you made?
What's in them?
It is.
We're not supposed to tell them, are we? Aren't we supposed to
Right.
guess?
There you go.
Well, I can't taste it, so I don't know.
So
We'll soon find out.
it's dates.
Oh.
Dates. Ah.
We like
There you
sticky
go.
toffee then.
So there's dates soaked in milk and then blended. And there's walnuts. There's porridge oats, which are blended to a flour, egg, and vegetable oil, and dark chocolate.
That is really nice.
Oh my God, they're lovely.
They are fine. You don't need only fish.
And they do like you can say it. Tell there's
I
no
can
sugar
taste
in
the
them,
dark
but it's
chocolate
still
in it.
got a sweetness.
Do you want one?
I'm all right.
Have one? No one else can go on.
I'll have one later. So thank you.
We'll have to share the recipe on the
The
episode.
texture of them,
If anyone at home wants to make it, which is a bit of healthy piece of cake, or as healthy as it can be, with some nuts and some dates in, good stuff in there.
Very nice.
You can put the recipe on the podcast episode. Great. So how are we all feeling about the new segment, Oily Fish, talking about what we're eating? And
Yeah, because it makes you more determined then
yeah, I think so. I think it can help
to
people
come
at
back
home
next week, or when we come back and say, well, yeah, I've done that.
You know, if you come back next week, we'll get another piece of cake.
Fantastic.
I'll bring something,
I think you.
what's that thing?
I don't know.
Mackerel patty. I'll make it out them tins.
Just bring the tins. It'll
I
be
just
fine.
wanted to
So in the
see if
Mediterranean,
you could make a cake
yeah,
with
this is delicious.
good stuff.
Oh, the feel of that is lovely, the textures
You got
in
the
it.
texture, yeah, because the nuts are there, aren't they? But then you also got the chocolate. the
And
dark
you can
chocolate.
taste that bitterness of the chocolate.
There you go.
There you go.
So
Isn't
we're
it
talking
gorgeous?
about whether we'll create our own cookbook, because we've obviously been out there, tried to find a cookbook that thinks about the lack of taste, but also thinks about the Mediterranean and the mind diets. And there isn't anything out there. So I think this will be one of the first recipes to be in the book. And over time, we'll start creating and talking about some, and eventually we'll create a book and you can buy it. That's the plan.
Okay.
There you go. Thanks, Marion, so much for making this delicious cake. And thanks to everyone for listening to today's episode. It was really good.
Delicious.
You two did a great job. Didn't even need me there, did you?
No.
It's a bit scary.
No, you did great.
We're all right.
No, only because you're forgetting things. Someone
We're
says
supposed to forget
No,
things.
you did great. So yeah, thanks everyone for listening.
Yeah, thanks a
And
lot, folks.
Marion, thanks for this wonderful cake. See you all next time.
Thanks for listening to us today. Hope it's been useful. If you have any questions or comments that you wish to make, just contact us on social media.
Thanks again for listening today. Just a reminder to do your own research. We always take guests, scientists, researchers, people supporting people living with dementia at their word. They might talk about things that are new in science. They might talk about things that have really helped them. So just a reminder, do your own research. And thanks again for listening.